Okay, so this is the classic setup for the ASMI treatment, whereby we have this is the Theraflex plinth, and it's very good for the kind of like this part, the face goes in there, looks slightly towards the feet, and then it sort of helps gently, gives a bit of a kyphosis effect here, rises up the spine a little bit here, so it's just easier for the ASMI machine to access the spine. This is the ASMI machine there. Now this is Plan B. Now this thing costs over £1,000. This thing is wonderful. This is my new setup. I'm just wondering if it's actually better. This is a kneeling chair I got from Amazon. I've taken it has its casters, the wheels here. I've taken the one off the front so it doesn't slip when we do the therapy, but it kind of gives you a bit of movability. By having the casters on the back, it sort of helps to also lift up the patient. And then this is a perch chair, just like that, and it's got you can change its height a little bit. Here, I mean, you can change the height of this one. I have it set to its highest angle, and I found this particularly good for ASMI treatment. And when I'm doing lots of patients, I will swap between this one and that one to get slightly different angles on the spine. More and more patients are telling me this is more comfortable it's less, just easier for them to get in and out of, because it's ultimately a kneeling chair. I don't know if I can do much of a selfie on this one, but you kind of kneel in here like this, and then you go down like this. It's very good for, I think you can see that, exposing the lower back as well as the upper back, and the patient can rest their arms on here, and or have a little massage table attachment here that they kind of rest their arms in here, and then sometimes they can actually rest their arms all the way hanging down the floor, because it's quite good to kind of get the shoulder blades lower. When the shoulder blades are very high, it's difficult to get the spine sometimes. And that's, I don't know, 40 or 50 quid. This thing here is a standalone tabletop massage thingamajig for, I don't know, of the order of 100 quid. And this perch chair is about 100-ish, something like that. I think less than 100, both of these. So it's, and then for different people of different lengths, you pull it out a bit. Now if you're a particularly long person, what you do is you put a second perch chair in the middle, and it sits nicely adaptable. These things are like super strong, and I think it's better. The patients are liking it more. I'm able to get at the lower back better, and also the upper back and the base of the neck better, so I'm very happy with that. If you have somebody particularly large, width-wise as it were, so that we need extra height, you can again higher these up a little bit. But I then often sort of move into wearing a pair of these very sort of platformy shoes, and that gives me pretty much the extra height I need for anybody really. Okay, so this is how the patient fits into the machine. It's into the new setup. Nicely curved there. With a nice, good, solid back, brings out the sort of top of the spine really well, so you can kind of the pistons can go either side really well and get at the vertebrae. Set up.